We're back on shift inside the ambulance.
Hello, Black Country! Hey, we're back!
Go, 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 go.
We're with the West Midlands Ambulance Service.
Whereabouts in your belly is the pain?
Does it look bad to you?
As they face more heart-pounding action
Okay, open chest for me.
Clear! Everyone clear!
and more medical emergencies.
Okay, we've got some good respiratory effort now.
Battling over 4,000 calls each day.
I can't help it.
Don't cry, darling.
I've had enough, you know.
Look at that.
There are some new faces
Can I wear the team shades? Pretty please.
and some old friends.
I love you, John Stevens.
No, you don't.
Yes, I do. My life has been positively dead without you.
Body-mounted cameras record every moment.
Can we come in and have a chat? Have you got a favourite teddy you want to take with you?
I'm going to need to shave you.
To show you what goes on behind closed doors.
All right, son.
We'll need to call security for these pair. They've been nothing but trouble.
You'll be on the front line with the ambulance crews as we take you inside the ambulance.
And off we go into the wild blue yonder.
Mum used to cheerfully turn around and say to me yesterday, she went, "You've got a lot of grey hair." Thanks, Jess. Help like that I don't need.
At least you've got here.
Good point, Mum made.
Come here, you've got a really big pokey eyebrow that's grey. Come here.
So you shouldn't pull out your grey hairs because 3 grow back.
Is that true?
And then I'll just pull the 3 out. I'm not fussed.
I'm not bald, I have it cut this way.
Okay.
Just make people think I look older. Because I can't get served beer in the pub otherwise. That's my excuse I'm sticking to.
Experienced paramedic V. Hodgkins is on shift with Rebecca Piddock, who qualified just over a year ago.
Ooh, blimey. We've got a category 2. Yeah. It's at a car garage. It's a 61-year-old male. Query heart attack. Clammy, same symptoms as last time he had a heart attack. Right. So it could potentially be pretty serious.
See whether we can get there quickly for him.
No pain at all, it actually says, yeah. Might not be a heart attack, might be another cause. I'm going to go for stab in the dark. I'm going to go for a bradycardic, slow heart rate.
Okay.
The call has come from a car showroom where the patient works.
Leave it here. It's just so that that red car can shift if it needs to.
Mode activated.
I think we'll get through, Beck.
Yeah?
Yeah.
Tight, but yeah.
Through. Where are we going?
Okay.
Is it Richard?
Richard has hereditary heart disease. He had his first heart attack 4 years ago.
What's happening, Richard?
My head.
You are clammy, aren't you? Yeah?
And that's been a symptom I've had before when I've had some weird turns. So I thought I'd better give it a call.
Okay, just rest
and
you
I
on.
feel like I haven't got any chest pains like for a heart attack like I had last time. But I feel like my heart is racing a little
Can roll
bit.
that sleeve up, mate. Okay, so how long did this start?
It's about 10 minutes.
Richard is already well known to the West Midlands Ambulance Service. 10 months ago, he was at work when he felt the warning signs again.
Woke up this morning with a pain just here.
Just in the centre of your chest, is it?
Yeah.
That time, it was a false alarm.
But unfortunately, you guys have been to see me a fair few times.
But 2 months later, he went on to have a second heart attack. Now he's worried there's another.
You don't feel breathless?
No.
And you haven't got any chest pain, is that right?
Not got any chest pain, but I'm feeling like I feel a bit peculiar in my
Peculiar,
chest, but
yeah.
not.
Okay.
And there's a list of all the medication.
All right, we'll have a look at that in a second. Just relax for me if you can. Okay, it's bradycardia. I'll have a look at that on here. Your heart rate's slow, okay? That's a posh word for a slow heart rate.
That's the thing I suffer with more than anything when I have a bit of trouble.
That's what's making you sweaty and things. Yeah. Bear with me just a second.
Are you okay if I pop these dots on your chest? Are you okay here? Because it's quite exposed.
I'm fine.
You're all right.
Right, let me
They've had me lay on the floor in here and all sorts of...
Brilliant.
We were both concerned when we got to Richard. He told us he's got a history of having 2 recent heart attacks. On examination, he was pale, sweaty. His heart rate was slow. He was on a medication called beta blockers, which does automatically slow your heart rate down. But his actual heart rate was a lot slower than we would normally expect, and we were quite concerned about that. Right, nice and still if you can for me, okay? Try and relax this arm just like a rag doll. You've had these done lots, haven't you, yeah?
Yeah.
So your blood pressure's okay, all right?
Good.
But it is a trip to the hospital, okay? Up to Russell's Hall. Where did you have your stents and everything fitted? Worcester, okay. Is that where you're from?
No, I'm from round here, but I was on a golf course when the heart attack happened in Worcester.
Ah, I see.
After his previous attacks, Richard had stents fitted to widen the arteries supplying blood to his heart.
So they put me there and they looked after me the first and second time as well. So.
While stents reduce the risk of a heart attack, they can't prevent one happening again.
What I need you to do, without too much effort on yourself, is up, turn towards me, sit down, cock your legs up and lie down. All right, that'll take less strain on your body. All right, Richard?
Yep.
You're fine. Well done. Is there anybody you want work to contact?
No, I've contacted my wife.
All relevant people. Contacted the boss, yeah? So going to be monitoring on the way to hospital, yeah? I'm going to put some big cold sticky pads.
Okay.
And that just means that we can... Sorry, this is really going to catch you.
No, it's fine.
The pads mean the crew can use a defibrillator to restart Richard's heart if he goes into cardiac arrest in the ambulance.
One of you gentlemen, can I get you just to carry that for me? Is that all right? Save me knocking your car. So, what I'm going to do, Richard, it's okay with you, pop a little cannula in your arm, okay? So your heart rate's picked back up again now a bit, yeah? But there's every chance it's going to drop low again.
Okay.
So if it does drop low again, then we can give you a drug that will speed your heart rate up, all right?
Yeah.
All right, let's just... Sweatings, yep.
It's
gone.
calm down.
Yeah? Right, we need to strap you in properly and then trip up to Russell's Hall.
Although Richard's condition seems to be improving, V keeps a close eye on him during the journey.
I just wanted to see your blood pressure again, all right? So I'm kind of happy that the heart rate we've got now is very probably your normal heart rate.
58, something
Yeah,
like
52, 53-ish at the moment,
very
yeah?
Good. Yeah.
Which would be what we'd expect with somebody that's on the beta blockers like you are. We just want to have a quick feel of your pulse to make sure that matches. Feeling a lot better than you were, yeah?
I feel it.
You've got more colour in your face now as well.
Richard will now be seen by a cardiologist who will be able to establish if he is having a third heart attack.
Oh, I saw one the other day. A guy had got a spot on the end of his winky.
Yes, yeah.
And he popped it and it was bleeding, so he called an ambulance. I'm like, that? Really? Like...
I had a patient yesterday, had a tumble. Caught her bum cheek on near like a shower base when she went down. Half of her bum was like a J-Lo bum. I've literally never seen a bum cheek as swole in my life, and it was solid.
I once come to a patient down here who was basically hungover. So he called us because he couldn't cope with his headache. And guess what? He didn't take paracetamol.
Oh, she's got a banging headache, wouldn't take anything for it.
That's it. But you know, nothing surprises you in this line of work.
Oh no.
Oh, this chair's cold.
Does it have a heater?
In Dudley, father and son team Keith and Aaron Charrow have just been called out on their next job.
We have got a 92-year-old female in Sedgley. So a lady who's got abdo pain, lower back pain, she's had a recent fall, she's got kidney failure, water infection and a history of stroke, but she has an existing speech difficulty following the previous stroke.
Aaron is a student due to qualify as a full paramedic later this year.
I love what our lecturer at university said. Kidneys are the most important organ in the body. The heart's just a stupid pump. You're okay.
Aaron's dad Keith joined the ambulance service nearly 10 years ago. He's now a clinical team mentor, which means he'll be keeping a close eye on his son.
How old again?
92.
I've switched on to close combat siren.
You get to go to uber close combat.
Yeah.
I think it's going to be one with the brown porch entrance here. Close to one next to it. Oh, still a nice big wide driveway, look at that.
We'll take it.
The ambulance was called by the patient's grandson, Barry.
Hello there, sir. How do you do? All right there. Where are we going? Just in here, mate. Lovely. Can we scoot past?
He and his wife Jodie are concerned about his grandmother's ongoing pain following a urinary infection.
How do you do? Are we here for yourself? Yeah. Lovely. What's your name? Oh, Marjorie. Hello there, Marjorie. I'm Aaron. This is Keith. Oh, you're going to make me shout, aren't you?
She can't speak very well because she had a stroke about 4 years ago, so she lost her speech. Okay. So she's fully compass mentis, but she struggles with the words coming out.
Okay. What's happened today then?
You tell me.
She had a water infection. My nan's prone to water infections. She got IBS. Mm-hmm. She has been in hospital before with low kidney function.
Okay. Marjorie, while we're having a bit of a chat, do you mind if my colleague does a few quick checks like your blood pressure? Oh, that's the spirit.
She's complaining of pain around the abdomen area and around the back.
So really, what's changed today then?
It's the pain. She's in a lot more pain.
Getting worse.
Yeah. I mean, the skin colour.
She looks a bit pale.
Yeah. Very lethargic.
Is your tummy normally this swollen, Marjorie?
No.
No, it does look swollen. Is it still painful at the moment?
It comes and goes.
Comes and goes. Yeah. Okay. Could you score it out of 10 for me, my sweet? 10's the most unimaginable pain.
Well. I'll say 10.
So it's very, very nasty. How old are you, my sweet, if you don't mind me asking?
Oh dear, I forgot. Oh, I'm just having my birthday.
You've just had your birthday.
Have you? Oh, congratulations.
92.
Yeah, you're not 92. Do you mind if I have a quick listen to your chest? Is that okay, my sweet?
What you do. You're getting done.
That's the attitude that we like. Marjorie, if you could just be nice and quiet for a few minutes and just breathe normally for me, okay, my sweet? What I'd like to do, folks, and Marjorie, I'll be talking to you as well. There's very little that we can do as an ambulance crew in terms of treating this. What we'd like to do, if that's okay with yourself, is get you seen by one of the consultants at the hospital to get this checked over.
Yes.
Right, I'll go and get a chair.
Yeah, chair.
Marjorie's husband died 15 years ago, and she's always remained fiercely independent. Until her stroke 4 years ago, she was still driving herself to bingo.
Marjorie, did you used to drink sherry or whiskey at all? Because a lot of people I meet in their hundreds and in their 90s used to drink whiskey or sherry. Yeah. I think there's something in that.
She'd love whiskey.
Right, Marjorie, whenever you're ready, in your own time, with a bit of help, we'll pop you onto this chair, okay?
After Marjorie was widowed, Barry moved around the corner to be nearer his grandmother.
And we'll stand on 3. Are you ready, chick? Oh no, we're up.
She's quite strong. Come out to me, that's it.
Got out of the chair pretty quick.
Oh no, I was quite surprised.
She's very strong.
You can sit down, Marjorie, trust us. There we go. On 3, ready?
Yep.
1, 2, 3.
Oh, fresh air, fresh air.
Lovely, isn't it, chick? You all right? Next thing we need you to do is to pop yourself onto this bed for us. We'll help you.
You don't give me 5 minutes.
No, no. Here we go. Oh, blimey. Oh, she's up. Would you mind, my sweet? Now I've got you laid down. If I have a look at your tummy, would that be okay? Would you mind?
No.
No, I'm going to need...
On,
All right.
what do you want?
All right. Have you got somewhere to be? Anything there? Smashing. Thank you, Marjorie. Cover your back up. Bless you. Would you like another tissue?
I've got one.
Oh, I've got a box. Have you always lived local then, Marjorie?
Yes, always.
Always. Black country born and bred.
That's right.
That's right.
Now doctors can establish if an ongoing urinary infection is what's making Marjorie feel so ill.
Oh, she was a brilliant lady, she was.
Yeah.
Very funny.
Caring family.
When she couldn't get her words out, she just laughed. Very funny lady.
Kidneys are not working, cause all sorts of havoc around the body.
Ooh, that.
Ollie, are we going over the metro thing
Yes,
again?
we are,
oh,
yes. What have you got to do?
I've got to hold your hand and tell
Hold
you
my
I love
hand.
you.
Are you ready?
That's all right, thank
You ready? Your hands are
Get
freezing.
squeezed, yeah, like my heart. Love you, Ollie.
There's a tram.
We made it.
Yeah, we made
Thanks.
it. We're safe. I've got us over the tram line. Just got to get through West Brom now.
It's going sunny. It's good I left my sunglasses in the car.
Grant Porter and Anna Ray have worked together for nearly 2 years.
Don't worry, it won't be long. 5 minutes, you're going to be pissing down again.
As well as his job as a paramedic, Grant volunteers as a special sergeant with the police.
I was just going, oh look, it's lovely blue skies, positive attitude now. Pissing down again.
Anna, who's from Poland, is a student paramedic.
Lovely blue sky. This is lovely blue sky there. Seriously.
I'm not looking
look
over
there.
that way. Yeah,
Look in
that's
front of you.
It always looks like that.
The crew have been called to a nearby doctor's surgery.
5-7.
28-year-old female having an asthma attack.
Receive, thank you.
Thank you.
A GP called the ambulance when the patient arrived fighting for breath.
Is that building there? That grey,
Oh, the grey
greyish
one.
yeah.
Oh, of course, it is, yeah. I'm going to go a bit there. It's done. Oh, it's fresh in here.
Hello.
The doctor has already put the patient, Christine, on a nebulizer.
I'll give you another check over and see what we're doing. You're right. Same as them, but different. And I'll attack this arm because it's closest to me.
Christine's struggle to breathe has brought on a panic attack.
Take this off in with that. So now we just need to calm the breathing down because obviously with all of it going on, you start to panic with it because it's crushed it, and then you can't breathe, and then you panic, then you can't breathe. It's a cycle that you're never going to win.
Crewmates Grant and Anna have been called to a doctor's surgery to help 28-year-old Christine, who started panicking during an asthma attack.
You can't breathe, and then you panic, then you can't breathe. It's a cycle that you're never going to win. What have you been doing at home then? What have you been painting? What are you painting with? Just normal wall paint?
Wall paint, gloss.
So it's been quite fumey in your kitchen. Christine been doing some decorating at home. With poor ventilation, the fumes could have set off her asthma. With her asthma and being short of breath, it's triggered panic, and it's got worse and worse. How long you suffer your asthma for?
2004. Since I got pregnant with my first.
Oh, right, okay. How many you had now then?
2.
Ah, okay. Do you smoke? That said it all then. How many do you smoke a day? Do you ever get on a bit lightheaded? Try and slow it down. Do you want to stand up for me, my love, and just make sure your blood pressure does it stand up? Take your time. If you feel a bit dizzy because of your lightheadedness, tell me. Just going to squeeze your arm again. Good and proper. Superb. Good healthy blood pressure. Spot on.
Christine seems to be recovering. But before they rule out a trip to hospital, the crew want to measure her peak flow, how fast she can breathe air out of her lungs.
Brilliant. 4:30.
That hurts.
Okay, you need to do it 3 times.
That hurts.
I know, you will. But we have to be cruel. Nice deep breath. That's fine, I'm happy with that. 4:30.
Once Christine had calmed down and the treatment had worked and the nebulizer had calmed her breathing, and we didn't need to take her to hospital, she'd gone back to normal. Christine was a smoker, and with her asthma, it's a really bad combination. It can make her asthma a lot worse and make her breathing a lot worse. And people who do have lung condition, breathing conditions, it's best if they try and stop smoking.
You won't believe I used to smoke 40 a day though.
Did you?
I've tried stopping it down really.
It's hard. I'm not saying
You
it's
just have
easy.
to really put your mind to it.
If you can get down from 5 now, that should be the easy bit then, shouldn't it? It's all in here, really. You can't knock it down
Speak
to
to your
2 and then
GP, they will
1.
prescribe you some stuff to help you.
Before she goes home, Christine needs to pick up some medication for her breathing.
Pharmacy is just here, isn't it?
Yeah, that's someone up to.
Yeah, I will go and get it for you.
Oh, in there.
You sit down and relax on the truck and I'll get it for you. If you will just sign for me, I'll go and grab it. Okay?
As she's still recovering and lives nearby, the crew have offered to drop Christine home. She lives with her partner and 2 children.
I had my youngest in my flat.
Yeah.
I didn't know I was having her. And I literally, she was breech.
What did you do, you having her?
I didn't know I was having her. Swear to God, till my waters broke.
So what were you doing when it happened?
Well, I had a pain in my side.
Right.
And it started on the morning. I went out, went to the pub with the bloke. He plays darts.
Yeah.
I didn't go back home till 11:30 on the night.
Right.
Went upstairs. It's getting worse. I think we got to the point where I literally couldn't stand the pain. Sat on my living room floor, the waters went. And she come out onto the floor. That was it. And I was like,
I've had a baby. I can't imagine.
Are you're driving? I don't know why I'm throwing it to you then.
Oh, right, you haven't heard the story of this one.
How old is she now? I don't know.
she's 7, my youngest.
7. I thought that was some time ago then. Yeah. Is that here? I'll open the door for you.
Oh, thank you.
Not a problem. There you go, chick.
Thank you.
Not a problem. Look after yourself, yeah?
Thank you.
And if you need us, ring us, okay?
I will.
Cannot believe she didn't know she was pregnant.
I know, so weird.
Can you imagine sitting there watching the telly or whatever and just suddenly going, oh, hang on, I'm giving birth?
Bear a minute with a cup of tea. I'm just going to give birth to a baby.
Bless her.
Never mind.
But she's sorted, she's been dropped round the corner home, she's got her medicine,
She's got her medicine.
and she's not taking up a bed, she doesn't need to
We've
be
done
stuck
good.
into. Teamwork.
He's on her phone. Get off the phone.
Phone down. On your belt. Yeah. Put the phone down.
Consider yourself told, Missy.
paramedic Laura Hickman is back on shift after annual leave. Her crewmate today is Stuart Punter.
Oh, here's one for you.
Okay.
If somebody doesn't like somebody on a bicycle, they're cyclist.
Oh! Smashed it.
Or are they cyclistist?
Right out the park.
They've just received a new job.
We're going to pen for Joyce, who is 84. Come through as a trauma, a back injury from a fall. Hopefully she hasn't actually injured her back.
I have missed the sirens on my 18 days off.
Sounds like it, yeah.
Blues and twos on, the crew arrive within 8 minutes.
Hello.
The alarm was raised by a carer who found Joyce on the floor.
Hello. How we doing?
Hello, darling.
Hello.
How did you end up on the floor? You don't ask.
I don't know myself.
You don't know. Do you know how long you've been on the floor?
Well, I was getting undressed to go to bed.
Okay, so potentially all night then.
It might have been all night. Can't remember, I'm sorry.
No, that's all right.
You don't have to apologise, sweetheart.
Is that normal for you? Have you fallen before?
Yes.
You have. Okay.
The same thing happened
When?
last month or last 6 months ago, I don't know.
Last month.
Joyce is a widow and lives alone. But one of her 3 sons is local, and she's also visited by carers 4 times a day.
Have you got up this morning?
I think so. I'm sorry.
No, it's all right.
Don't worry.
Joyce was in a nightie. She could have fallen that morning when she got up out of bed, or she could have been there all night, so up to 12 hours. Joyce not being able to recall the event and not being able to remember when she'd fallen was a worry for us as well, because we had to try and work out whether she'd lost her memory because of the fall, a head injury, or whether it was normal for her.
Do you normally have a bit of a dodgy memory?
I don't suppose you can remember if you lost consciousness or blacked out or anything?
I don't think I did.
No. Did you go giddy when you fell? No. Oh, you're ticking all the right boxes, Joyce. You're doing well.
Can you move all your arms and legs and everything?
Have a wiggle. Have a dance.
Marvellous. Can you lift your legs up?
No.
What's stopping you?
Me back.
Do you normally have pain in your back?
Not normally.
No.
To assess Joyce properly, Laura and Stuart need to get her upright.
Right, can you sit yourself forward, Joyce? How's that?
All right.
All right.
Me back, me waist.
Your back or your waist? Whereabouts?
Is that a pain?
It's a pain.
Oh, it's a pain now, is it?
Whereabouts?
I'm sitting on it mostly.
On your bum?
Yes.
That's not your waist, that's your bum.
Is it?
Okay, you ready?
Yeah.
How you feeling, Joyce?
All right. Oh, my legs are going up now.
You're going to be dangling off the edge in a minute.
We'll give you a bit of a zhuzh because you're quite low down, aren't you?
Push with your legs, push, 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 push.
Perfect.
How do you feel stood up, Joyce?
All right.
You feel all right?
Oh, he's missed one son.
There you go, look.
Joyce is still confused, and the crew hope some of the gaps in her medical history can be filled in by her son Russell, who's just arrived.
Falling over again?
Yes.
Flat on the floor with that pen.
Russell, I'm Stu. This is Laura. Just come and have a word with your mum and just let us know if she's normal or not normal, because or as close to normal as we can get it.
Well, that's the difficulty. I think she has pains in her back. So
normally?
Yeah.
Okay.
So if you ask her if she's hurt,
Yeah.
she'll say, "Oh, my back."
She did mention those,
So
yeah.
that's every day.
Okay. Are you in any pain, Joyce, now?
A little bit.
A little bit.
Just, I'm conscious of it, shall you put it like that, but I'm not. I'm not in a screaming position.
Yeah.
Okay.
Okay. Are you in any pain, Joyce, now?
A little bit. Just, I'm conscious of it, shall you put it like that, but I'm not. I'm not in a screaming position.
Okay. Are you in any pain, Joyce, now?
A little bit.
Laura and Stuart are satisfied that Joyce doesn't have any physical injuries requiring a hospital visit. But Russell is concerned his mum's confusion is growing.
Since Christmas, what I've witnessed is a marked decline in the last 4 weeks.
Okay.
Marked decline in her ability to know where she is, what she's doing.
Okay.
You know, her family all want her to be in a place where she's going to be looked after. But
It's better for her, isn't it? Yeah.
if you ask her, she'll say, "Oh no, I want to be at home." So
It's quite a common thing, isn't it, that we find with patients such as your mum who would benefit from being in care, but they don't want to be.
I do sympathise with Joyce's son. It must be hard having an ageing mum who's getting more confused and more vulnerable and still living at home on their own, so you're constantly worrying that they're not safe. But on the other hand, I can also sympathise with Joyce as well. We go to a lot of elderly people who fall, and it's quite sad really, because sometimes that's the start of them losing their independence.
Joyce, your button, the button you've got round your neck, do you know how to use it?
Just press it, surely.
That's it, yeah.
But when do you press it?
When I'm in urgent need of somebody.
Like when you're on the floor?
Didn't I use it?
You didn't.
It's sort of new.
Right.
Joyce, would you be happy to have a doctor to come out and just have a look at, see if they can help you with other things around the house for your mobility? You know, like handrails, and see how else they can help you.
Just to try and prevent you from falling.
Yeah. Would you?
I don't know why I fell. Well, this is the annoying part.
Yeah.
It just happens though sometimes. We all fall.
Were you using your frame?
No.
Ah, I think you need to start using that one a bit more.
That may be the problem. Because the thing is...
Don't get old, don't get old.
Don't get old.
Don't get old. Bless you. That's the problem though, isn't it? Because we all fall over, but unfortunately, at my age, we tend to pick ourselves up a bit quicker than people who are a bit older. But we'll always come and pick you back up again.
But you must promise that if you fall over again, you've got to press your button straight away.
Okay, thank you.
You're very welcome, Joyce.
I think we need to go.
No, yeah.
Satisfied they've done all they can for Joyce, Laura and Stuart leave her in the care of her son.
Thank you.
All right, sweetheart.
Yes, you take care.
Bye.
Yeah, it's a shame that it's all sort of happened so rapidly. I wonder what the next steps for her will be. I think she'll fight fiercely to stay at home, which is fair enough. I think I would.
Yeah. But ultimately, it's kind of, it's one of those, isn't it, where you all know best. We can all see that it would be best, but you're taking away someone's independence, aren't you?
So where's the weirdest place you've had to use the toilet then on a job? You use every patient's house normally, don't you?
I like to use.
Have you ever gone into the bushes?
No.
Trees?
No.
I have.
Have you?
Yeah.
Have you?
Sometimes you have to, don't you?
No, you hold it.
I can't hold it. I'm nearly 50.
Working a late shift in Dudley are ambulance crewmates Lee Farley and Nicole McClintock.
Would you like a bite of my Groove bar?
Oh, thanks. We've been the Groovy Gang.
Their next job has just come through.
999 mode activated.
So what we're going to now, we've got a 72-year-old male, Parkinson's patient that's fallen with a head injury.
Yeah.
And this one's in Bewdley, is it?
He's got a bleeding wound and a new visual disturbance.
The call is to a town centre high street. It's just after pub closing time and the police are on hand.
Hello.
Hello. Members of the public said he's just been walking up here. They've just watched him literally take a tumble back and he's banged his head.
The patient was out with his family when he fell. Another police officer is looking after him.
In a second, chap, I'll just take over from you if that's all right.
No, I'm just holding the pressure on.
Okay. Lovely. Hello, David. Hello. Right. We'll have a quick look at your head. Have you hurt yourself anywhere else? David? David? Don't think so, just your head. More of a grace, isn't it? Okay. Right. What's David's mobility like on a good day?
Average.
Average. He has Parkinson's disease,
Yeah.
so he's mobile, but
Limited.
it's
Okay.
hit and miss.
We're going to bring the stretcher in behind and see obviously how we can get him up off the floor, all right? Get him in the warm and then we'll sort him out.
Lee and Nicole want a better look at David's head.
Let's try and get you up off the floor then. Bring that leg back up.
Night shoot. Move your feet, sweetheart.
Let's get you on the ambulance, shall we?
He's bleeding and they want to make sure he's not concussed from the fall.
David, yeah?
Sorry?
Is your name David?
Yes.
David, I'm Nicole. All right. Let's get the heat on.
You've been there about 40 minutes then on the ground.
Around 40 minutes.
Walking with family, just went straight back. Did you go onto your bottom first?
No, I remember sitting on the cold floor.
Okay.
David, you've got a bit of a cut to the back of your head, sweetheart, so I'm going to try and clean it and see what damage is done.
Did I fall down?
Yeah, he just took a tumble.
Do you remember falling, sweetheart?
No, I don't. My left hand side feels sore.
Left hand side feels sore.
When this side.
Yeah, it's probably where you took a bit of a bump sweet.
Oh yeah, there is, yeah. It's just part of the skin. It looks superficial. So I think it's probably only about 3 centimetres.
Right, he has medication for Parkinson that he takes 4 times a day.
In my top pocket.
David has Parkinson's. Some of the medication that he was taking can cause some dizziness, unsteadiness, a bit of confusion. It sort of made our job a bit more complicated in the sense of trying to establish, was he dizzy and slightly disorientated due to the bump on his head, or was it due to his Parkinson's and the medication he was taking?
David's son and daughter-in-law are waiting anxiously outside the ambulance.
Hello.
Okay.
He's okay, yeah, we're just okay.
David.
Hello.
It's all right.
Can we just quickly need to know, is there any other medical problems?
He's got Parkinson.
Any like heart problems?
No.
Strokes?
No,
Mini strokes?
no.
Diabetes?
No.
Okay. And walking with yourselves, just went back?
He was with you. He just literally just fell over and went backwards.
He just slipped backwards and
Is
just
that-
lost his footing.
He's not always steady on his feet.
And just fell back and hit his head. We've all had a little bit to drink, haven't we, David? And you did
He's
as
had
well.
a pint of shandy,
What?
a whole pint of shandy,
That's what's done it.
and
Yeah.
Bailey's.
Yeah. We need to have a look see if there's any other injuries. If that's the only injury,
I think it
then
is,
we'll
but
put
yeah,
it
he
to
was out
them
with us and he was absolutely fine and dandy.
Lee and Nicole want to get David to hospital to treat the wound on his head. His family will follow.
Yeah, I'm happy now, like.
You say it's 12 midnight.
It's 12:30, 25 to 1 in the morning.
I'm straight, I think I've lost some time somewhere.
Well, you've been out drinking tonight, David.
It seems a long time between
when I was started talking, to when we were in the ambulance, and he said it was midnight.
A long time since when, sweetheart?
From when I first went on the ambulance to
You haven't been on the ambulance that long.
Now David's at the hospital,
Got my bumps, sweetheart.
A&E staff will tend to the cut on his head and check his medication.
What do you make of David?
Unfortunately, he'd been on the floor for the best part of an hour, so he got a bit of a numb bum. Cut to his head wasn't major, but just needed cleaning up and dealing with in hospital.
Richard, who feared he was having a third heart attack, was monitored in hospital for 2 nights before doctors judged he was safe to go home. He continues to take his medication and has regular checkups to keep an eye on his heart disease. "92-year-old Marjorie was diagnosed with an ongoing urinary infection and dehydration. She was put on a drip to rehydrate and discharged home the same day. After a further 10-day course of antibiotics, she felt much better. Joyce has had several more falls since the crew attended her, but hasn't been hurt in any of them. She's still living at home, where her carers and son Russell keep a watchful eye. David didn't need stitches for the cut on his head. He was kept in overnight for observation, but with no sign of any serious head injury, he was discharged the following morning.
I feel like I'm driving around in circles.
No, not often. Feels like this job, doesn't it?
We get a bit giggly next with One Born Every Minute, and be here Monday at 10 for the all new and exclusive Emma Willis Delivering Babies.